cause. But again, the mode of spread of hepatitis of different viruses, which I told you now, is different from each other. So if you look at the example of hepatitis B and C, usually they are spread by blood spread, either by contaminated needle or using a syringe or a razor which has already been used by somebody else. So this is the most common way of hepatitis B. Particularly, this is commonly seen in drug addicts. Whereas hepatitis A, D, and E are mostly spread by water. That is the fecal-oral contamination, where hygiene or taking good quality of water is extremely important. Now, when you look at the symptomatology of hepatitis, acute viral hepatitis symptoms are almost similar in all the viral hepatitis. So it is very difficult to distinguish only by knowing the symptoms. So what are the common symptoms of hepatitis? One is patient comes to us with nausea, malaise, sometimes even vomiting, fever, body pains, or if you examine the patient, there will be yellowish discoloration of the sclera. So if you find this, then you are almost sure that probably you are dealing with a hepatitis infection. So to know which type of hepatitis we are dealing with, what you have to do is you have to get some blood tests done. So the common blood tests which we do commonly are for hepatitis A and hepatitis E. We do hepatitis A IgM as well as hepatitis E IgM. So this would be sufficient in most of the cases. And then we also get the liver function test done. So in case of viral hepatitis, irrespective of whatever hepatitis you are dealing, the SGOT or the ALT or SGPT or the AST, both these enzymes are extremely elevated. The bilirubin can be mildly elevated, or sometimes it may not be elevated also. Later on, over a course of time, these viral markers come down. And somewhere in the course of the disease, patient may complain of itching also. So this phase, what we call it as cholestatic phase. So it is always important to keep in mind the hepatitis whenever the patient has symptoms of nausea, malaise, vomiting, body pains, or some vague symptoms, and then get appropriate tests done. So these are some of the important things. Now, what are the precautions to avoid hepatitis? So as far as the hepatitis B and C are concerned, I told that this is transmitted by blood spread. So you should not use contaminated syringes. You should not share the razors or pricking items. Particularly, this is more common in drug addicts. You should so drug addiction itself is bad, but you should specifically teach these people that sharing of needles will cause hepatitis. And the long-term complications of hepatitis B and C are that these people may land up with chronic liver disease and cirrhosis of liver, and sometimes they may also develop hepatocellular carcinoma, which is life-threatening and dangerous. Even if the patient has cirrhosis of liver, there is no treatment for cirrhosis. Only liver transplant is the only treatment which is available. So prevention is the best possible thing in all these cases. And you also have vaccine, particularly hepatitis B vaccine, where you can take the vaccine. And also there is a vaccine for hepatitis A also, particularly in children with you. As far as the treatment of acute hepatitis is concerned, we ask the patient to maintain good hydration, take plenty of fluids and juices. Sometimes we also ask the patient to take plenty of glucose, provided the patient is not diabetic. So the energy requirement of these patients is high. So that is why we advise the patient to take plenty of fruit juice with water. And usually acute hepatitis is a self-limiting condition. Extremely rarely you may have hepatic encephalopathy, which is seen in 2 to 3% of the patients, which is extremely dangerous. But otherwise, acute hepatitis is self-resolving, and you can hasten the recovery by advising the patient to take appropriate dietary or nutritional requirements. But supposing the patient has hepatitis B or C, we should follow up these patients for a long period of time and see if the patient is going for cirrhosis, and then advise the patient accordingly. Thank you very much for your patient hearing.
Sir, your introductions, clinic and name, sir.
This is Dr. N Md Athaullah, consultant physician. I'm practicing at Santosh Nagar, Hyderabad.